What is up, everybody? We are back, another Tuesday episode, and today I just want to give an update with how my knee's been doing since surgery, and I want to talk a little bit about a supplement that I've been using, bpc-157. Now, before I start this video, I want to state that I am not a doctor. This is not a guide to treatment. This is just my experience and what I've been doing that's been helping me. So before you think about doing anything that I'm going to talk about on this video, definitely consult your physician first and follow their guidelines. So with that being said, I had knee surgery on November 19th. They went in and repaired my ACL, removed a cyst, strengthened it up, tightened it up, and immediately following that, I started physical therapy. And I had been doing physical therapy for 3 to 4 times a week for the next 6 weeks it was. So I've been going for probably about a month or so, and I was seeing great results, but like anything, recovery from a surgery isn't a straight line. There's good days and bad days, and I had hit a little bit of a plateau, I felt, where it was going to be a little bit difficult for me to get past this area that I was in. I really wanted to see a little bit better results than I was getting. But I also was dealing and have been dealing with golfer's elbow, which is medial condyle epilepticus. Try to say that 3 times fast. And what that is golfer's elbow from repetitive motions. I really developed it through training martial arts and boxing, just the pounding that your elbows and joints will take. So that was really bugging me. And I had just got done with knee surgery, and I really was not interested in having a doctor cut me open and go through all this stuff again. It was starting to really radiate down into my hand as well. So I knew something needed to be done. And I had talked to my orthopedic surgeon, and he had talked to me about cortisone shots. But if you know anything about cortisone shots, they're actually deteriorating the tissue. So that's kind of the opposite of what I want. I understand that it takes you out of pain, but in the long run, it's actually doing more damage. So that's not what I was interested in. I was trying to figure out something that would help me heal. And I was doing my research, and I came up across a supplement called bpc-157. What that stands for is Body Protective Compound 157. And I'm going to try to explain this to you the best that I know. And what I know about it is a string of amino acids that are found in our gastric juice. So we already produce this naturally. And what that does is it helps promote healing. It helps promote healing of tissues, ligaments, any type of damage that might go on through your skin, your muscles, your tissues, your ligaments, like I said. This chemical would then be produced and sent to that area to help promote healing. And when we're young, we're producing a lot of it, and as we age, we produce less and less of it. So it becomes harder to kind of heal from these types of injuries. So after doing my research, most of the research on humans is anecdotal evidence, just evidence of people that have taken it and what their results are. There are some studies in rats where it has shown to regrow tendons right after an injury. So that was really, that really intrigued me. So I had done a bunch of research. I found some good sources that I could trust. And I decided that I wanted to try to take this for a month. So after talking with my fiance about it, she said, I don't want you buying this online from some online resource. I want you to go to your doctor and see if he can prescribe it. So I went to my doctor. Well, I found a doctor that deals with peptides, because that's what this is. This is a peptide. And I went to him, and the first thing that they wanted to do, which really made me feel safe, was they wanted to do a blood panel. They wanted to take my blood and take a look at everything in my body, how everything was doing, because this promotes the growth of cells, from what I understand. So that could be a good cell or a bad cell. So they want to take a look at how your body is doing before they start you on one of these supplements. So I did that, and that was really beneficial because I was ready to have a physical anyway. So it was perfect. After getting the results of my blood work, everything was great. I am in great health. So that made me feel really good. And they gave me a month's supply of oral BPC-157. Now you can do it orally, or you can also do injections. And the reason that we did a month's worth of oral first is because we wanted it to work systemically. We wanted it to work not only on my elbow, but we wanted to promote a little bit of healing in the knee and also any other nagging injuries that I might have had. So I took this for an entire month, and within a week or so, I could start to feel my elbow loosening up. The pain was not radiating down into my hand anymore. For the most part, it was starting to feel really better. Now, whether that's placebo effect or the amino acid that I'm taking, who knows, but I'll take those results. And so after a month of it, I could feel where there's still a little bit of benefit that I could gain from a little bit more. So I decided to try 10 days worth of the injections, and I'm on day 2. Yesterday was my first dose. Today was my second dose, and you know, it's feeling good. It'll probably take a couple more days to know if it's gonna work even more than the oral, but for what it's worth, this stuff is great. It's really helped me. It's a little bit expensive, but for me, when I stop and think about the CBD creams, the trips to the chiropractor, the different things that I'm buying to massage my arm, it's really a fair trade-off month to month. So I've gone with this. I've taken it for 1 month. I'm on my second month. I'm also taking it orally as well as injections. And I'll let you know how that's going. As it is right now, a lot of the pain is out of my hand. I still, on some days where maybe if I'm drilling through concrete or doing a lot of repetitive motion, I might get some tingling or numbness. But it's really, really helping the pain, and from what I understand, it's actually helping me heal. So I'm really excited to see what the next 8 days of injections will do, and then continuing with the oral bpc-157. So if this is something that you might be interested, do your research, find a physician who deals with men's wellness, and consult with them. Not to say that the online websites aren't selling you legitimate bpc-157. It's not pharmaceutical grade, and anything that I put in my body, I want to make sure is the top of the line stuff. We're not putting any willy-nilly junk in our bodies, so we want to make sure we're doing the right thing. So like always, like this video so other people can find it. Leave me a comment if you've ever tried bpc-157 or if you're interested in it. You know, I'd love to hear about that. And like always, subscribe.